Thank you. Yep, I want to spend some time to give a few examples of the projects in our group on PET, SPECT, and CT using deep learning. So I will start, and Bo from our group will finish up. So started with some SPECT projects. So we start with some parallel whole scanners. We want to see if we can increase, reduce the acquisition time, and also through this sparse field acquisition, and potentially kind of enable fast acquisition for dynamic imaging using the conventional scanners. But in that case, we really need to deal with the sparse view problem. So one of the approach we try to use is to use the dual domain sinogram synthesis from the sparsely acquired projections. So first, we have an image domain process that we can take the sparse view data and through LEM reconstruction to get an image reconstructed from the sparse data through an image-based network to generate a full projection like reconstruction. But this one, we want to use that to forward project again to generate a prior information in the sinogram domain. And we put it back and combine with the acquired sparse projection data together and go to the second step is a sinogram-based network so that we can generate a predicted full view projection data from the sparse view data, and later on combine with the original data so we can have the predicted combined full view for this sparse view SPECT reconstruction. So here are some examples of this is the full view and this is the sparse view. The first two columns here are data using approaches from previously published work from JNM on lutetium PSMA SPECT studies. And here are this column is just using sinogram-based prediction. And the last one is a combined sinogram with image-based network. So it seems that we have the lowest bias. And image reconstruction also show that we have the smallest bias using this approach. And Xun Chao in the room, he did all the work for this study. And move on to the next project for PET motion correction. This particular example, we're looking at a whole body dynamic PET. So it's a 90 minutes dynamic scan. We can see that we typically frame duration is 5 minutes, but between all those 5 minutes framed, we have motion. So when we put them together, will inevitably affect the accuracy of a tracer kinetic modeling through this voxel by voxel kinetic modeling fitting. So previously, Xueqi in our group did develop this work, this convolutional LSTM network. So with this image similarity and displacement regularization in the loss function to perform frame by frame image registration. It's pretty fast through deep learning, so we can have more accurate tracer kinetic modeling. And in the latest work, we kind of added this PET-lag model fitting error into this loss function, because at the end, we really want to have an accurate tracer kinetic modeling and through the parametric image generation. So at the end, we're kind of using this approach. It's more like a biology-informed type of network, so we can incorporate tracer kinetics behaviors into deep learning-based image generation. So here, this is Xueqi here in the room. And you can see that comparing with all different other approaches, the last column is our network with PET-lag plot into the network loss. So here we overlaid Ki and the VB. So for Ki is the PET-lag plot intercept, VB is the Ki is the slope, VB in the intercept, while Ki is more affected by the later stage data, while VB is more affected by the early frame data. So there's a mismatch indicating there's a long-term motion. So you can see that the mismatch is original without any motion correction, but after all the corrections, particularly the last column, give us the best match. And also the voxel-wise fitting error map is the lowest using this approach. And here's another example in the body region. So here is an example of using deep learning to correct inter-frame motion for whole body dynamic imaging, but there's also within each 5 minutes frame, there's a still intra-frame motion that we couldn't correct. So one of the approach we have been using is through list mode event by event motion correction. So using some internal external correlation work we have previously developed. So based on just a one-dimensional external motion marker, we developed a correlation so that we can derive voxel by voxel 4-dimensional motion vectors at each time point. And based on that motion information in the reconstruction, instead of reconstructing sinogram, we reconstruct each event. So we reposition each event, but letting them going through forward projector and the back projector through the curve instead of line of response. And this curve is derived at each time point, each voxel based on the previous step. So extended that into continuous bed motion data from single bed data. So this is a work from Yurong in working together with Xueqi. You can see that second column, if we only correct the intra-pass motion through this event by event motion correction, we can have a sharper images in the Ki and the VB, but the mismatch between the Ki and the VB, that's still there. But if we only correct the inter-pass, we have a better alignment, but the image are blurred. So when we combine both intra and inter motion correction together, it gives us the both high resolution, high contrast, but also the better alignment between Ki and the VB, indicating more accurate tracer kinetic modeling. So moving forward to a topic of denoising that we have talked a lot in this workshop. So one thing we found that particularly for PET, because different tracer, different patient, different tracer injection, different acquisition time, post-injection delay, all the variation in the clinic. So the count level from in each patient really varies from patient to patient. So if the training network would train on one noise level, but the testing data set is on different noise level, we found we have a kind of a suboptimal result. So this is the work, it's trying to see that if we can use this noise aware component. So in addition to directly apply the network into noisy images, we train the network into several different networks, and each network has different count levels in the training input. And after that, there is also another noise aware network component that takes each individual testing images into the network and predict what will be the weighting factor based on the pre-trained different network of different noise levels. So hopefully we can have just one network, but uniformly robustly applies to all different noise levels. So here are some examples showing this is from Huidong's work in this room. So here are 1% counts and 5% counts. And these two networks are trained with just exactly matched count level in the training data set, matched with 1% and 5%. And the third column is this unified network. So when one network applies to both 1% and 5% and comparing to 100% those levels seems to be pretty robust. And also this gives a good tool that for dynamic imaging, because we have a different count level, because of decay, and each frame have a different count levels. So we can apply that also similarly to dynamic imaging. Here are example from Chung showing that if we have a 100% or 25% individual dynamic frame, but through tracer kinetic modeling, if it's 25%, 100%, we have a little bit noisy indirect images through tracer kinetic modeling fitting voxel by voxel. And even direct parametric reconstruction reduce the noise a little bit, but not a lot. But if we pre-denoise each dynamic in the frame, and after that, through indirect approach for tracer kinetic modeling, we see a dramatically reduced noise levels and also the fitting errors. You can see this is our fitting errors much lower with the noise using this approach for individual dynamic frame. So I will probably stop there, and I will we'll continue this presentation.
Thanks. Sorry.
Yeah, looking for you.
Okay. Yeah. So we see great success with motion correction and denoising for PET using deep learning. But one issue is like it typically requires long acquisition time, and it requires external device for recording the motion information, and it's typically specific to motion type. So we are thinking if we can accelerate the PET acquisition and reduce any residual motion regardless of the motion type. So to address this issue, we propose a deep learning add motion correction framework for accelerated PET. So the general idea is, okay. Yeah, so this one? Oh, okay, the section. Oh, okay. Yeah, so the general idea is like, given a 2-minute acquisition, we can actually first split that into many continuous ultra short frames, and then we can perform a simple line of response back projection to generate a point cloud image, and then we can denoise this point cloud image because it has a very low count and a low image quality. Based on those denoised point cloud images, then we can use deep learning based motion estimation network to estimate a quasi-continuous motion field over all those ultra short frames. Then we can use the original 2-minute list mode data, two-minute list mode data, and all those motion field and integrate into a motion compensate OSEM algorithm to generate a preliminary 2-minute motion free reconstruction. But because this 2-minute still has low counts, it has a high noise level. So we further propose to do a short to long acquisition reconstruction, which is actually based on a generative adversarial network here. So to further convert this image into a virtual long acquisition motion-free image here. So just want to quickly show you some intermediate results from this framework. So the first row is the point cloud images. And the second row is the denoised point cloud image, which actually we aiming to match the gated image noise level. So we can obviously see in this example, there is a respiratory motion pattern that pushing the liver and pancreas up and down. And after our motion estimation, and we use that to deform those point cloud images, you can see all those images aligns pretty well with the chosen reference frame here. And here I want to quickly show 3 patient example of using our fast MC PET. So the last column is like we're only reconstructing it using the 2-minute acquisition, and all the so we compare to the standard gated plus registration plus averaging method, and also the index method, which is the method she just presented a few minutes ago. So for the first patient, you can see like this patient has a body motion during this acquisition. So you can see the overlapping shadow here. And all those previous methods actually did not take consideration of other motion type because they're almost specific to respiratory motion. But our method can actually address this motion type. And for the second patient, this patient only involved respiratory motion. So you can see like we have actually a better resolution recovery in the pancreas region here. This tracer is actually developed specifically for pancreas screening. And for the third patient, we can also see it actually have a better bowel motion correction, which is probably one of the most challenging motion to be correct in PET imaging. Okay, so all right, so we see DL has great success with nuclear medicine imaging, but a lot of those models are actually trained locally with limited data. So to get a robust and generalizable model, we actually really need a large-scale data with diverse data with rich representation. But it's really hard to collect, transfer, and warehouse those medical data due to challenges such as data privacy concern. So to address this issue, we actually conduct the first study on federated learning solution for multi-institution low-dose imaging in collaboration with University of Bern at Switzerland and Raging Hospital at China. So we propose federated FTN, a personalized federated learning strategy based on feature transformation network. So the general idea is that we can use a locally capped feature transformation network to modulate the denoising network. And during the federated learning process, we can only upload the denoising network to the central server and aggregate and redistribute. And the local network will modulate those feature output from this denoising network to adapt to different distribution at different institutions. So here I want to quickly show several examples of how our method in contrast to the locally trained model. So for the first institution is Yale, second institution is University of Bern, and the third institution is Reading Hospital. So you can see for the 5% low dose at Yale, you can see this locally trained model actually has some artifact in the liver region, but this federal learning method can actually better remove those things. And for the second institution and third institution, you can obviously there is a resolution improvement for this denoising results. So we actually, okay, this is a pretty overwhelming slide with lots of results. So actually each institution has 3 low dose levels. So we actually take all those into consideration during this training process. And we also compare to several previous federal learning reconstruction framework that already proposed in TMI and CVPR. But all those methods developed for 2D MRI reconstruction, but we still extend them to 3D and compare those methods. So just want to quickly describe some example from our Yale data set. So for the 5%, you can see like for all for both previous method, like federal SP, I consider that as state of the art, but it still have some like over blurring in the spine region. But our federal learning method can have a better spine resolution recovery. And for the 10% low dose, you can see there is a false positive signal in the spine region. So the last row is actually the ground truth. So you can see like previous methods still like kept this false positive signal, but our method can much better like suppress that signal. So now I would like to switch the track a little bit to CT imaging. So CT is not only really important for PET for like attenuation correction, but it's like standalone, it's of great diagnostic value. But so dose and metal artifact are 2 major issues in CT. So most of the previous work addressed those like standalone challenges, but never really considered them like simultaneously. So here's a quick illustration of what happened if you have sparse view CT and metal in the image. So you can see if you just use a standard FBP reconstruction, you will have a very severe like streak artifact across the whole image. And for low dose CT plus metal, like it's slightly better, but you still see a lot of streak artifact in near the metal, but in a global scale, you still see the noise is impacting the image quality. So first, to address the sparse view CT plus metal, we propose a dual domain data consistent recurrent network to address this issue. So the general idea is because most of the previous conventional metal artifact correction method is in sinogram, so we can do the restoration in image domain and the sinogram domain, and we do this in a recurrent fashion. So during this recurrent fashion, we also want to keep because we already sampled the sparse view data, so we want to keep the projection data in there. So to do this, we actually also use a data consistency layer. So basically the process, like given an input image, we can do a forward projection and then convert it into a sinogram. And then we can basically replace those already sampled projection data in non-metal region, like into this sinogram, and then do a filter back projection to generate image with data consistency. So here are some quick example of how dual net perform as compared to previous standalone methods, such as like those citations are here. So DDNet and CNN MAR. So we show for 50% downsampling, 75% downsampling, and over 80% downsampling rate, our method can consistently outperform those standalone methods. So on the other hand, for low dose CT plus metal, in this scenario, the sinogram is not only noisy because of the low X-ray flux, but it's also corrupted by the metal. By the metal. So it's really critical to first restore the sinogram with high fidelity before we convert that into an image for further restoration. So so following this idea, we propose a sinogram to image domain progressive restoration network. And to enable high fidelity restoration in each domain, we also propose an under to fully complete backbone network to achieve this. So here shows some here shows the architecture of our backbone network, the UFNet. So the idea is pretty simple. It's a multi-stage network. So you have a under complete network and a fully complete network. So the under complete network basically is has downsampling and upsampling. So this type of network is actually more suitable for general structure recovery, which is really important here because we need to impend the metal region here. And then we use the encoder and decoder feature during this process to guide the fully complete network for fine detail restoration. So yeah, there are more detail in the paper, so you're welcome to check. And so this is some quick illustration of the results. So we have half in the dose and quarter dose. And we also compare to previous standard long metal artifact and low dose CT reconstruction method. So we also see like we can have a better structure recovery here. So yeah, to here, we would like to acknowledge all the NIH grants and our lab member. Yeah, thank you.
Great job. Questions? Actually, I was really excited about your federated learning approach. What were the issues with that of dealing with the different sites, and were all the protocols all the same, and did you have to do some kind of data harmonization or normalization?
Yeah, that's a very interesting question. Like, because we collect 3 sites, so one is in Asia, so the demographic is like a lot of Asian, and then Bern is like probably almost as wide. So like there are a lot of data heterogeneity. So yeah, we saw that, but this is like the first try on see like, okay, if we just have some way to keep the data privacy and still aggregate those data, what will happen? But we see like consistent, like actually improvement with significancy for all those class data.
Great.
Yeah.
There's a question here. Yeah.
Hi, Chen and Bo, nice talk. I have actually just one topic to Bo's part, the motion compensation part. So 2 short questions. One is when you do that, like you basically split the data like from like chunk by chunk, and how long that basically the length of the data, how that impact performance. And the second short question is you also mentioned you do denoising before you do the motion field estimation. So my second question is like how strong that denoising network should be and how that impact performance.
Yeah, I think that's a great question. Yeah, I think that's a great question. So for the first question, I put on the slides, but I didn't mention it. Like we are using a temporal resolution of 500 milliseconds now, but if for cardiac motion, we probably need a higher temporal resolution. Yeah, so but this is just to demonstrate that this framework will work. And for the denoising part, actually, because this is an open framework, you know, like all those deep learning components you can replace with like diffusion model or whatever, like more advanced component. But we're just using UNet for all these deep learning components here. But if we change it to like more advanced structure, it could be like it will have further improved performance.
All right.
Thank you.